So healing in the heart. So many challenges, so difficult, and so many questions about what to do with healing the heart. What are your thoughts?
Because the heart problem is the number one death rate in the whole country. So if the people, number one, so many people die of the heart problem. But a lot of people thinking it is the number one death is the cancer, not true. So we must know why so many people die on the heart problem, not the cancer. The West, how they treat the heart problem. So they depend on the pill or the pacemaker surgery. They say in the heart, we need to, number one, need to know what is the heart function. The heart function is dependent on the signal and the nerve system. So the nerve signal is from our medulla in the brainstem. Any cardiologist in the whole world, do they know where is the heart nerve? So without the nerve, how can you heal the heart problem? So in my healing, I just say also the nerve. Another thing on the heart is the signal from, they call the cardiac center, because the signal is from medulla or from the medulla. So if they pay attention on the nerve, the whole healing result and the whole healing method will be changed. I do a lot of the heart problem. Include, I treat 4 people have the heart cancer. I will give you the example, the governor cancer.
So how do you deal with the heart problems?
Okay, number one, we must know where is the heart nerve located. The heart nerve basically is one is we call the vagus nerve. The vagus nerve is make the heartbeat, regulates the heartbeat or the heart function. So that is on the neck area. But no cardiologist say, oh, I go to find your vagus nerve. They know where is the vagus nerve on the picture, but we are not talking the vagus nerve. We talking the blockage in the vagus nerve. So the blockage of vagus nerve is on the C2, cervical number 2, behind the jaw area. The expert, no matter from mainstream or alternative medicine, nobody checking the vagus nerve that's under your ear. That is called the C2.
What do you find with your patients? What do you see that?
So when we check it on this area, we call the vagus on the C2, cervical number 2, 1, we can see the people by the eye look at. We can a lot of time have the mole on that area. Or number 2, when you press on that area, the whole body will jump. That will be painful. On this area, we is called the blockage. We need to open the blockage. So another nerve for the heart is the sympathetic nerve. So the sympathetic nerve is on the back, on the thoracic. On the thoracic, number 5, on the left-hand side, that is the sympathetic nerve for the heart. So, do we any people check on them? No. So, if you can find out the blockage on the heart area for the heart, sympathetic, parasympathetic, we can save a lot of their life from the heart attack, from the heart problem. Vagus is the cranial nerve number 10, but that is the branch of the parasympathetic nerve. So the 2 nerves, we need to open it. Then we heal so many different kinds of heart problems, include the heart cancer.
But other people deal with this, you know?
No, not yet. We go to find out on the brainstem, it is the medulla area. Medulla, we cannot touch, but we can find out the blockage outside can affect the medulla's function. That's what we heal so many heart problems, include the heart cancer, heart failure, or we just have in the class, one guy have a hole in the heart, but the hole too weak, the hole is filled up, no more problem. That is what the West miss, the nerve system for the heart. They have EEG, they have EKG. If you have the electricity on the heart, so you must follow the cable. Where is the cable? So that's what they mean. That is what we are so successful. Heal so many heart problems.
Is the process for healing when we transition to cancer in general, is it similar, is it the same, or is it a little different in how in your practice we deal with cancer?
Okay, cancer is tough. So everybody phobia when you're talking to cancer. So on the cancer, number one, we know how they treat the cancer. They call the three things: chemo, surgery, radiation. Now, plus the target, or we call the immune healing. So what is the percentage they can heal the cancer? So a lot of the doctors say, oh, lifetime you not heal the cancer. Not true. So why the West so difficult to heal any type of cancer, or only besides the basal cell cancer? What is the worst, the cancer? Usually the lung or the breast for the woman. Now it's the prostate for the male. So the cancer on the medical study, it is the metabolism problem, not the immune. But when the one who has the cancer, the first thing they say, oh my God, build up your immune system. I say, no, immune system is to protect the cancer cell. So they protect it, what they call the protective. They call the immune escape. Immune escape is to protect the cancer. So we on purpose destroy the immune. Chemo destroy the immune. Radiation destroy it. So anything immune therapy, they destroy us. Why we not follow the study? Put the cancer healing on the metabolism system. So another thing is in the Nobel Prize, 1931, then Dr. Otto Warburg found out that oxygen, deficiency of oxygen may cause the cancer. Lately, we found out bioelectricity can cause the cancer. And the latest one is nerve problem cause the cancer. That is all of the study. So who is the one use the oxygen? Anyone use the bioelectricity? Is anyone use the nerve system? That's why we do the study. In the study, we found out the nerve system causes the cancer. You can check on the cold spring water.
Spring
Harvard.
Yeah.
Harvard, cold spring Harvard. They found out in Einstein Medical School, UCLA, so many medical schools found out nerve system cause the cancer. But in our practice, did anyone use the nerve system to healing cancer? Any people use a bioelectricity to charge the cell to healing cancer? No. So that is against what is on the medical science study. The Dana-Farber, in fact, it's a Harvard Medical School. They did the survey with Dr. Amy Sullivan. Did any people pay attention on that kind of survey? No, not yet. That means everybody have a user. You must sell your house. But they work in the study and they say can make the people last 2.8 months. In China, the report is 3 to 5 months, last longer. Go to change the environment. The environment on the cancer area, number one is the nerve. Number two is the oxygen. The oxygen have an oxygen nerve called the phrenic nerve. Phrenic nerve is on the neck area. One more thing is in our practice is use the anti-gravity. Now I know you know Elon Musk. He used the anti-gravity to make it the space. Yeah, already long time I used the anti-gravity for healing cancer. How? Because on the tough, they do the study and send the tumor to the space. The tumor disappears. So this means that anti-gravity or gravity level can affect the tumor. So that's what we use. All of that kind of motor neuron. In the medical study, they know that motor neuron near the biophoton. But how can you charge the biophoton to the motor neuron? In our way, we use the quantum physics. Quantum physics, we use the double slit experiment theory with the observation effect. On the observation effect, then we can make the particle entangle. So this means we can entangle photon go into the motor neuron. Then the motor neuron get charged with the biophoton. Then the disease will be healed. Did that make sense?
Makes perfect sense. Autoimmune. Same process for healing. And what do you see as the cause and what are we missing?
What is the West healing the autoimmune? Now beginning using more chemo for the autoimmune. So far, I know in my knowledge, Hashimoto disease, autoimmune, Crohn's disease, rheumatoid arthritis for the autoimmune. Do they work? We put a question mark there. So we need to check their study. So autoimmune is the T cell function. Our body, the T cell attack the good cell. They call it the autoimmune. Arthritis. So rheumatoid arthritis is the T cell, the function attack the joint, cause the arthritis. So this means the T cell function abnormal. The T cell attack the fiber, we call Hashimoto. The T cell attack the stomach, we call the stomach ulcer. The T cell attack the intestine, we call Crohn or Christ. So this is a T cell function. So in the medical study, where the T cell function comes from. T cell function is on the medical study, is on the thymus gland. Thymus gland is a control the T cell function. Who pay attention on the thymus gland? So the thymus gland have a two nerve also. We found the two nerve, they block. Open the blockage of the thymus gland, then all, it doesn't matter what kind of autoimmune, they will disappear. Enteritis, arthritis, cellulitis, bursitis, all the ITIS. What can they do? Because on the study, why nobody pay attention on the thymus gland? What kind of voice problem? But what is the nerve for the voice? So on the voice, they have two major nerves. One is the cranial nerve number 9 and cranial nerve number 12. But all of them is on the neck area. So if this nerve getting pinched or blocked, then the voice can heal or good enough. That's not only the voice. Some people difficult swollen the foot down, same nerve. So actually a lot of people have a speech problem. They have to know. Because when you found this nerve, not to say I give you a pill or do the surgery, open it, found out the blockage on the two nerves, then he can be healed. Biden, what he have? Dementia.
Dementia.
You know, when he walking up and down on the airplane, he knows there's a dementia.
Yes.
That is a motor neuron problem. Why we give all the injection or pill? This means the whole country, nobody know how to heal him.